On this week's edition, we're going to take you inside an operating room at Stafford Hospital and explain to you what this sophisticated piece of equipment does for patients here in our region. Thank you to our sponsor, Shore United Bank. For 150 years, Shore United has been helping businesses grow, families thrive, and communities prosper. Visit them downtown or at Harrison Crossing. Today I'm at Stafford Hospital in one of the operating rooms, and I'm with Dr. Chang. Dr. Chang is a urogynecologist and reconstructive pelvic surgeon for Mary Washington Healthcare. And this is where Dr. Chang performed the majority of his procedures. So Dr. Chang, thank you for joining us.
Thank you. Thanks for your time.
Tell people in layman's terms kind of the kinds of procedures that you do.
Absolutely. So I am a urogynecologist, and urogynecology is a pretty unique field. So it's a combination of certain parts of urology and also surgical gynecology. And we're considered the de facto experts in the diagnosis and treatment of pelvic floor disorders. So pelvic floor disorders in women, they encompass a whole bunch of different conditions. These are things you see after childbirth, after menopause. The big three I usually mention are pelvic organ prolapse, urinary incontinence, which is leakage of urine unexpectedly, and then fecal incontinence as well. So, the important things about these conditions is that they're really, really undertreated and they're really underdiagnosed. The disservice to women is that they don't really get to care because a lot of women don't know that these conditions can be treated. I think nowadays there's a better conversation about pelvic floor disorders, social media, with the internet, with people being more open to talking about this. You can imagine these can be, quite embarrassing things to talk about, even to your own doctor or your OBGYN. However, because there's more open communication about these things, people are getting to treatment, and, urogynecology is where we can discuss, the different things that we do. In terms of treatment, we're really kind of full service urogynecology here. So what that means is we can not only see patients in an outpatient setting, we have all the testing available, the diagnostic equipment available to kind of appropriately diagnose patients with these certain pelvic floor conditions. But we also can affect all of the different treatment options that range from conservative treatment options all the way to surgery.
Your actual outpatient practice is located not far from here at Embry Mill, is that right? In a
Correct,
fairly
yep.
new facility that Mary Washington Healthcare opened there.
So yes, you're right. Embry Mill is one of our newest outpatient offices. It's a beautiful facility. I'm part of a practice there called Mary Washington OBGYN and Primary Care. Just like the name implies, we're really trying to make that practice a full service health center for patients. So we have primary care doctors, we have family medicine physicians, internal medicine doctors, we have advanced practice providers, as well as the OBGYN side. We have nurse midwives, we have generalist OBGYNs there. And then tucked into that practice, I provide the urogynecology services. I also have another partner who's an expert in minimally invasive gynecologic surgery. So he does a lot of advanced pelvic laparoscopy with keyhole surgeries for big fibroids, complex endometriosis cases. So we really have a lot of subspecialty kind of tucked into that one practice. Now, within that one building as well, quite literally, somebody could see their primary care doctor. If they needed labs, they could get their lab work done. If there's imaging needed, and entrance and get that imaging done. Have physical therapy on site too.
But all of your surgeries are performed here at Stafford Hospital, which
Correct.
is really just down the road from your practice.
So not the biggest of all hospitals when you look at it on paper, but because of our size, it's a very personal hospital. There's a small team here. We all know each other's names. So, the teamwork here is unparalleled. And that's part of the reason why I chose to, do all of my procedures here as part of Mary Washington Healthcare. There's 4 main ORs. We have 2 of them equipped with state-of-the-art robotic technology. This is part of the Da Vinci 5 robot. So these are the 4 arms that control instruments. They're attached to ports that connect to instruments that go within the body. I control the robot. The robot does not do anything by itself. These arms, it's kind of like a spider. It goes right over the patient, and these arms have, a very significant amount of range of motion, so they can move around. I best think of this as an extension, like a tool for my hand, that helps me fine-tune all of the movements within the body. This here is the console that we sit at during surgery. So this is a 3-dimensional view through these viewfinders. And then these are the 2 arms where I can move the arms that you see on the other part of the robot that we see. So this setup is actually pretty unique. We have two consoles in this room, and being that we're a teaching hospital, that means that a learner and a surgeon, or in certain cases when two co-surgeons want to do a case together, then we can actually do that in this particular room. So not all hospitals have this setup.
So tell people a little bit about yourself, like kind of where you're from and what brought you to Fredericksburg and what attracted you to Mary Washington
Sure
Healthcare.
thing. So I am a Virginian through and through. So I was born in the Norfolk area. I spent most of my life growing up in Fairfax County. I stayed here for medical school at VCU in Richmond, and then I did my residency at University of Virginia. I left briefly to Florida for my fellowship training. Then I, found myself back here. So I have a lot of family in the area. My in-laws are in the area. With two little kids, it was just natural to come back and be closer to family. And I'm really, really happy to be providing these services in this particular area. But still, the need is so great for these types of services, and there's kind of an island between Northern Virginia proper, Fairfax County, DC area, all the way down to Richmond. So this is kind of a unique spot for us to be able to bring these services to the women in this area.
Yeah. Well, Dr. Chang, I know you're a busy man, and so I appreciate you taking a little bit of your time to do this interview and tell people a little bit about your practice and yourself and the services that are offered here at Stafford Hospital.
Thank you so much. Thanks for giving me the opportunity.
Yeah.
Thanks for your time.
Okay.
Yep, thank you.
All right. Okay, so that's going to do it for this week's edition. We appreciate you watching. Be sure to subscribe to our YouTube channel and our newsletter, and we'll keep you up to date on business stories such as this one here in the Fredericksburg region. See you next week. Again, I want to thank our sponsor, Shore United Bank.